GFR is a calculation. It basically takes into account main things that it takes into account: age of a person, gender of a person, if they are African American or not, and then their serum creatinine. And there are tons of calculators online if you ever want to check it out. I have included a link to a calculator for DaVita Kidney Care, their large kind of corporate dialysis center. But you can check the serum creatinine. You can put this in. Normal serum creatinine for people is usually between like 0.8 and 1.3. So we can put in an example here of, let's do 0.9. Let's say that we are young and healthy. We'll say we're 25. We'll pick female. And then we're going to select not African American. So then we'll hit calculate. And we come back with a GFR value of 89. Now, there's different variations on what is normal. You'll see on the side here, it says that we're actually in stage 2 kidney disease. It's actually because 90 is the cutoff for their example. This is actually still really pretty normal. But I want to bring up this GFR because it actually is kind of important for the radiology department. We want to know what the GFR is on our patients because they are going to possibly get some sort of contrast during their MRI or during their CT. And we know that it all is kind of combined. We watch each other's backs. And so GFR above 90 is considered normal. 100% normal, don't have to worry about it. It means that the patient clears 90 milliliters of blood per minute. And that means that all that contrast will get filtered out very quickly. They'll be fine. When you get into the 60 to 90 range, we get a little worried. It's moderate. We just want to make sure that we are telling the patient that they need to drink extra water, just to make sure that they are flushing their system well. Most places will even go down to 45, kind of as a bare minimum GFR. And then anything under 45 is going to be no contrast. And that's because that contrast won't clear their body quickly enough. It sits in there and starts to cause some problems within their system. One of the really kind of crazy things about the kidneys is that you can lose a lot of your kidney function before you even start to notice it, before there's any symptoms, before your GFR changes, any of this. So in our example, we can see again that it's telling us that this patient is in stage 2 kidney disease. It's mostly normal, except we would be a little bit more concerned if they had high blood pressure, if they had blood in their urine, or if they had extra protein in their urine, extra ketones in their urine. So GFR isn't everything. We really want to take a look at what their kidneys are filtering, what they're not filtering, what they're dumping into the urine, what's hanging around in the blood because the kidneys can't filter it out. All of that combined helps us to understand a little bit more about kidney disease and what stage the patient is in. Let's go back and just try a little bit higher. Let's try like a 1.5 creatinine on an older patient. This is probably more our population, let's say 55. Let's make them male, let's make them African American. African Americans tend to have lower GFRs, and so we want to make sure that we are not assuming that their system will be able to clean out the creatinine the same way that a non-African American person's system would. So let's calculate this, and this brings us down to 60. And look, now we're right at the end of the stage 2 kidney disease. So this person could still get contrast. They could still have imaging done like that, but they're really quite on the edge here. Let's go ahead. We're going to keep everything the same. I'm going to bump this up to, let's say, 2.8. We'll calculate that. That drops them down to 28 and puts them in stage 4. So like after you kind of reach this threshold, you go downhill pretty quick. Doing renal ultrasounds for acute kidney disease or chronic kidney disease, renal failure, super, super common. So you'll quite often see decreased GFRs in their blood work.